It can be really hard for a baby who's experienced a tough birth to breastfeed. Birth trauma is a real thing that it could be hard for the mom, but it also can be hard for the baby. Things like a forceps assisted delivery, a vacuum assisted delivery, a long stage 2 labor. These are all things that can cause trauma for the baby, and it can take a little bit of time for them to overcome this trauma in order to successfully breastfeed. Babies who experience trauma could be more lethargic, they could be more irritable. There are ways that a skilled lactation provider can help you and your baby overcome the pain that they may be experiencing after a traumatic birth. So specific things that I like to use in my practice for traumatic births are increased skin to skin, gentle infant massage, non-nutritive sucking, and also finding breastfeeding positions that are not painful for the baby. One thing that I see that actually really does make a difference for irritable, stressed babies is tucking their bodies into flexion and being mindful of any sort of tender areas on a head that may have been assisted through the birth canal. Finding alternative positions for latching is also really important to help baby manage pain that they might be experiencing if they had an assisted birth. Things like side lying, upright feeding are all things that can reduce pressure on the head. It's really important that you have somebody who has the experience of working with this type of birth in order to protect the breastfeeding relationship as baby heals and overcomes these challenges.